Saving Gotham is a behind the scenes, in depth look of what can be considered the most drastic public health campaign of the 21st century. Tom Farley begins his story by providing readers with a first hand account of his experiences with the New York City Health Commissioner Thomas Frieden. Frieden, along with his team of health experts, worked closely with Mayor Bloomberg. They banned smoking in bars, outlawed trans fats in restaurants, and even attempted to cap the size of sodas. While controversial, his initiatives worked. By 2011, 450,000 people had quit smoking, obesity rates had dropped, and life expectancy was rising. Our author Tom Farley succeeded Frieden as health commissioner and continued his mission of making New York City healthier. Saving Gotham demonstrates how policy change and local government work together to protect citizens and transform health in quite literally life-changing ways.
Various bans have successfully been used in public health to reduce unhealthy choices and to promote healthy choices. Instead of spending time and money educating about the negative impact of poor health habits or the positive outcomes that we can experience from healthy lifestyle choices, bans demonstrate how changing the physical environment is an effective, if not necessary, step to changing behaviors of individuals within a population. Instead of relying on individuals to say no to highly addictive cigarettes or highly palatable foods, bans change the landscape in one fell swoop.
Now, one may ask, why are bans like ones created for trans fats and indoor smoking created in the first place? Better yet, why are public health officials wasting their time implementing these bans that quite honestly could potentially backfire in the long run and create more controversy than saving lives? It's true that in public health we don't know exactly what the outcome of these interventions may hold. In public health, though, it is our goal to try and prevent as many deaths as possible and stop unnecessary events from happening, like heart attacks and lung cancer. The bans that were created in Saving Gotham helped preserve many lives in New York City, and they did this not only making it harder for people to continue these bad habits of smoking and consumption of trans fats, but making them contemplate their own potential risk and decide what they were going to do about it. Creating the smoking ban in bars and restaurants and the bans of trans fats by substitution of healthier options helped pave way for many citizens of New York City to think about their perceived risk and take proper action to help eliminate the threat of these public health enemies in their life. So why are the use of these bans important to public health? If we can prevent the effects of these public health enemies from even happening just by changing one's mindset, we can save many lives opposed to just one. And eventually, if done just right, as public health professionals, we'll run ourselves out of a job.
There are many reasons why one should care about a smoking ban and a trans ban. There is no risk-free exposure to secondhand smoke, and it causes nearly 34,000 deaths a year. Secondhand smoke is extremely harmful to children and can cause various harmful conditions to their respiratory system. It has also been shown that a smoking ban lowers the amount of people that smoke, thus saving many lives of smokers as well. Trans fats can be dangerous as they coat and harden arteries around the heart, which leads to heart disease, the #1 cause of death in the U.S. Trans fats are easy to substitute, and many cannot tell the difference between the substitutes and normal trans fat. This is why a ban on both would save countless lives.